Welcome, Doctor in Sudan Elite Medicine. Make information easy for you. Most terrible disease responsible of wide deaths in Sudan now, yes. Today, we're talking about dengue fever, one of the most important mosquito-borne diseases worldwide, and a growing health threat in many tropical countries. Dengue fever is a viral infection transmitted by the Aedes mosquito, mainly Aedes aegypti. It is caused by the dengue virus, which belongs to the flavivirus family. Dengue is common in Africa, Asia, and Latin America, and its incidence is increasing every year. Types of dengue virus. There are 4 different serotypes of the dengue virus: DNV 1, DNV 2, DNV 3, and DNV 4. Infection with one type gives lifelong immunity to that specific serotype. But secondary infection with another serotype increases the risk of severe dengue due to immune enhancement. After the mosquito bite, the virus enters the bloodstream, infects immune cells, triggers a strong inflammatory response. This leads to capillary leakage, low platelets, bleeding tendency, and in severe cases, shock and organ failure. WHO clinical classification. According to the World Health Organization, dengue is classified into 3 categories. 1. Dengue without warning signs. Patients may have high fever, severe headache, pain behind the eyes, muscle and joint pain, nausea and vomiting, skin rash. This stage is usually self-limiting. 2. Dengue with warning signs. Warning: these signs indicate possible progression to severe disease. Severe abdominal pain, persistent vomiting, bleeding from gums or nose, lethargy or restlessness, enlarged liver, rising hematocrit with falling platelets. Backhand index pointing right. These patients must be admitted to hospital. 3. Severe dengue. This is a medical emergency. It includes dengue shock due to plasma leakage, severe bleeding, severe organ involvement, liver, brain, heart, kidneys. Diagnosis. Diagnosis depends on the day of illness. In the first 5 days, NS1 antigen test, PCR if available. After day 5, dengue IgM antibodies, rising IgG levels. Supportive lab findings include thrombocytopenia, leukopenia, elevated hematocrit, elevated liver enzymes. Differential diagnosis. Always rule out malaria, chikungunya, Zika virus, typhoid fever, other viral hemorrhagic fevers. Treatment. Latest guidelines. There is no specific antiviral treatment for dengue. Management is mainly supportive. Mild dengue, no warning signs. Oral fluids. Paracetamol for fever. Adequate rest. Avoid NSAIDs, aspirin, steroids. Dengue with warning signs. Hospital admission. For isotonic fluids. Close monitoring of vital signs. Urine output. Hematocrit. Platelet count. Severe dengue. ICU care. Rapid resuscitation of fluid. Blood transfusion if massive bleeding. Oxygen and organ support. Platelet transfusion is not routinely recommended, only if there is active bleeding. Fluid management. Critical point. One of the most important principles in dengue management is overhydration can be fatal. Fluids must be carefully calculated, continuously reassessed, reduced once plasma leakage phase ends.
Thank you for watching. Don't forget support us and subscribe. Next video about bilharziosis.